Okay, guys, Assalamu alaikum everyone. Welcome back to this channel. This is me, Alia Wahid, and you are on the channel of Medicare. So, as you know, that we have started the practicals of pharmacy practice, and in the previous video, we have discussed. So now we are going to start the experiment number 6 as per the requirement of our syllabuses. So experiment number 6 will be about dispensing of allopurinol suspension, which strength should be 20 mg per ml. It means in 1 mg you will supply the 20 mg of allopurinol. So, what is the objective of making allopurinol? Actually, this drug is available in the form of tablet, and we are converting our tablet into the suspension form. So, why we are dispensing in that way? What is the importance of it? So, the major importance or objective for this purpose is to increase the administration. So, for example, if a child came to you who cannot swallow a tablet, so you make the suspension out of it, and then it will be easy for that child to swallow it or to take the medicine. Similarly, if an very old person came to you and he cannot swallow a tablet, same he will swallow the suspension easily. So this is why, and why we are making it suspension only, because allopurinol is slightly soluble into water, and so that's why we will dissolve it into a vehicle, and so that we make the suspension of it, not the solution. So the second major objective of this is that we have to make our customized dosage form. In in the tablet we can have every strength, like our tablet can be 200 mg strength, it can be, and in the pharmacy, for example, it can be 300 mg of the tablet, but we have to reduce its strength to 20 mg per ml. So this is why we are doing the dispensing in that case. And it also will improve its bioavailability, it will also increase its shelf life. So our generic name of our this experiment is the allopurinol. And why we are giving this suspension, what is the purpose of it, and what is the use of it, therapeutic use if we talk about. So it's therapeutic use. We give this suspension in the case when the patient have the disease of gout or the uric acid, because the uric acid accumulate in the joints and they it cause the disease of gout. Similarly, if a patient who have the stones of calcium oxalate in her kidney, in her urinary tract, or at anywhere, this allopurinol suspension will treat the gout, and as well as it also reduce the formation of calcium oxalate stones. And we are giving the dosage form of suspension here, not the tablet, not the solution, and the strength would be 20 mg per ml. This is our major thing. And stability, because we are dispensing it now, the expiry date of the tablets which are make from the industry, they are for many years, like 2 and 3 years here. But when we convert this tablet into a suspension form, now its stability decrease. Now it will expire within the 60 days now, or you can say the 4 weeks. And now, because after the dispensing, there are highly chances of that medication to disturb or to become unstable in that case. And you have to store this suspension within the refrigerator or at the room temperature, not at very high temperature. So that's why you have to make sure of it. So what is the procedure, how you convert this tablet into the suspension form? So let's talk about the procedure of it. So what is the procedure it has? You have to first of all make the grind powder of your this drug allopurinol, and you have to lavigate it. So lavigation is very important a process that you should know, that we take our fine powder and we mix it within the small amount of vehicle. So we mix it in the pestle and mortar, and we make the paste out of it. So after lavigation we get a paste. Okay. And then we have to add our the remaining or additional vehicle into it to make the uniform suspension. And after that you have to make up the funnel volume, shake it well, because you now the suspension can be flocculating, the floccules can be settled to the down and form the cake here. So that's why shaking it is very important for it. And before taking the suspension, you have to shake it well, so that the particles should be uniformly distributed throughout the vehicle, and it will make it more effective. Okay, after discussing the procedure here, now we will talk about what is the role of ingredient here. So we have two ingredients that we use here. First is our allopurinol, and second is our vehicle. Okay, so allopurinol, it is here to treat the gout and uric acid and calcium oxalate crystals, because it inhibit an enzyme which is called xanthine oxidase. This is an enzyme that convert hypoxanthine to xanthine, and xanthine to uric acid. So what this conveyance is, so let's talk about this conveyance at this side. So what is happening inside our body is there is a substance which is, or a chemical, you can say it anything. This is the hypoxanthine, and it is converting into xanthine by an enzyme which is called as xanthine oxidase. Oxidase. Now your allopurinol, what it is doing, it is inhibiting this enzyme. Okay, now your allopurinol is inhibiting this enzyme, and now hypoxanthine cannot be converted into xanthine, and xanthine is converted into the uric acid. And this uric acid, when it produce, it accumulate within your joints and causing the disease of gout, and it also promote the calcium oxalate stone formation. So when you inhibit the xanthine oxidase enzyme, now your uric acid will not produce, now it will not accumulate within your joints, and gout will not be happened. So this is a way, this is the main ingredient. It mean allopurinol is your active ingredient here. If we talk about the vehicle here, so it is just to facilitate the stability, so that the patient can easily take it. He cannot feel the bad taste of it, and it can be make the suspension out of it. So your suspension should be sweet in taste, it should be viscous, it should be smooth consistency, it should be translucent, and it should be unique and uniform within the its composition here. So if we will talk about what things we required for it. So, for example, if we want to make the suspension out of it, okay, guys, let's talk about the vehicle it has. So, how to make the vehicle? So, actually, its vehicle contains the ratio of it contains 1% of methyl cellulose. So, how to make 1% of methyl cellulose? You will dissolve 1 gram of methyl cellulose into the 100 ml. Then you make the 1% methyl cellulose, and similarly, you have to make a simple syrup. Whether you can make your simple syrup through the BP method or the USP method, and you have to mix the 1% methyl cellulose and the simple syrup in one ratio. It means you have to equally add them. If you take a 50 ml of your simple syrup, then you have to take the 50 ml of methyl cellulose, 1% solution of methyl cellulose there. So this is a way that how you produce your vehicle, and then you will dissolve the allopurinol into your vehicle and make the suspension out of it. So this was all about the things that we are discussing here, and I think all the concept will be clear to you. And if still if you have some confusion, then let me down, I will give answer to you. So make sure to subscribe to my channel and press the bell icon, so that you can get the notification of all the videos that I will be uploaded. Thank you so much. Meet you soon in the next lecture. Remember me in your prayers. Allah Hafiz.